Hello, everyone. Hello, and I'm glad to hear and see you, and all experts of all kind. And we are really happy that not only business analysts and product manager come to us, but also software developer, engineer, manager, and really all kind of experts. And today I'm glad to represent you the opening a new substream in the healthcare domain. And it's mental health. It's very extremely valuable, extremely important, and very interesting for me. And if you're interested in contribution or just have some questions, please ping directly Oleh and Yulia. They can help you, and maybe you can find the place if you want to develop this expertise within EPAM and healthcare and life science community. Also, I'm just kindly remind you that you can join, and we will warm welcome you and participate with your idea, your development. Okay, and just I want to just maybe give a word to the Oleg and Yulia, our today's speakers, and they will continue and open to you this quite interesting topic. Oleg, Yulia, the floor is yours. Thank you.
Thank you, Vitaly. Hello, everyone. We're very pleased to be here today with you. So yes, today we will talk about the mental health in IT topics. So at first we will do a short presentation of ourselves. So I'm Oleh. I'm working as a business analyst for more than a year, around 11 months in EPAM already. And before entering business analysis, I worked in mental health in different positions. I started as a nurse in psychiatry clinic. Then I was a psychiatrist. Also worked in addiction medicine, in child psychiatry, in adult psychiatry, and besides my MD and doctor's education, I also passed training as in group psychotherapy and group psychoanalysis. So this is from my side. Yulia, passing the word to you.
Hello, happy to see all of you here. I'm Yulia Buchynskyy. I work in EPAM for a year and a half. Before of that, I've been working, I moved to IT domain from philology. I'm PhD in philology and started to study neuroscience in 2017. My first startup, Happy Brain, won Creative Business Cup Ukraine second place in 2020. And this year, we won Hackathon Hack for Peace in mental health domain with the startup Vesna Health. So I'm happy to share you my experience as a startupper in mental health domain.
Thank you, Yulia. So I suppose we can start our presentation. So what we will be going through. So we will define what is mental health. Then we will move through the shift of attitude, how the attitudes to the mental health domain changed during the history. Then we will go through the overview of the domain itself and the challenges it faces. And then Yulia will cover the mental health digital market map, the solutions that are presented, and the unicorns, yes, the current and future unicorns in the domain. So I'll begin my part here. So what is mental health? So according to World Health Organization, mental health is understood as a state, yes, of mental health well-being, which supports people in their life. It is a component of the general health, yes. It is basic human right. And one important thing that it is crucial, yes. So it is important it is understood as a very important part of the person. And another note that I gave is the mental health is not just an absence, yes, of mental health disorders. I wanted to highlight the biopsychosocial mental health model. So, and the idea here that the mental health is understood not just as a part, yes, of the part of the body, yes. So it's not only really related to the brain or the nervous system, and so on. Although it is important, so we have like additional. So we have like areas which are overlapping between each other, and together they bring this mental health. Yes, this bring they shape it. So we have the biological layer, the social and environmental layer, and the psychological layer. And each of these layers, layers together brings the mental health. So, but it was not as it is now. It was not always understood as we just mentioned. So, I'd like to go through the shift of how the attitudes and understanding of mental health was changing during the history. So for example, in 50th century, yes, just to begin from not far too long, so the mental health disorders were mostly understood as some kind of an evil forces, yes, that impacted the person, yes, and they were, and these people were moved out of society or burned, yes. Then from the 15th to the 18th century, some clinics started to appear, but these were actually not the clinics in the normal, yes, or our understanding. It was a kind of, like jails where these people were just put to isolate them from the society. And this picture is here. Here it is the very famous picture of Philippe Pinel. It is a French psychiatrist who was the first one to remove the chains from the mental health disordered people. Yes, so it was a very big shift because they were enchained, imprisoned. Yes, they were left alone. These clinics were very awful. Yes, there were no good condition there. So it was the first step in a better approach to such kind of disorders. Then in the end of the 19th century, we have Emil Kraepelin, who was he was not the first psychiatrist, but he was known to create the first classification of mental health disorders. So he tried to map all the disorders to the nosologies, and nosologies is a kind of disease. Yes, so he tried to create this medical understanding. Then at the beginning of 20th century, I've highlighted here two persons. They're not the only ones, but they're important. So we have the Karl Jaspers, who was a psychiatrist and then moved to philosophy. And he was the representative of phenomenology. And phenomenology brought another layer to mental health. It brought the psychopathology, which is the very good and profound descriptions of people's feelings, states, and what do they experience, yes, when they go through different states or disorders. And then we have Sigmund Freud, yes, who started to create this like conscious and subconscious model, yes, of how the mental health actually works. And it was he was not the first psychotherapist because he came from hypnosis. He started he like learned hypnosis and was a neurologist, but he tried to create a more profound model of how the mental health works. And it brought a lot of different schools because a lot of his students after him were some of them like followed psychoanalysis, some of them were opposed to his theories, but this understanding started to bloom, yes, and a lot of different schools started to appear. Then there was another black page of the history. It is the T4 program, yes, in the Third Reich, where a lot of mental health disordered people were just killed or burned, yes, due to this eugenic approach of clearing the society, of moving the mental health people out, yes. And it actually did not give any results because, for example, statistically, a lot of, for example, patients with schizophrenia were killed, yes, but in like next like 20, 30 years, the same approximate 1% of society that always suffers from schizophrenia returned. So it means that it's not only about the genes, yes, and not only about the reproduction. Then we have the creation in the mid 40s, in the mid 50s, we have the first psychopharmacological medication created. It was chlorpromazine, and doctors saw that the psychosis, yes, can be treated with this medication, so their hallucinations and other symptoms reduced. So they started to treat the patients with medication, and it brought new medications in further. And after that, there was a big shift from moving from the inpatient level of care, where the patients are mostly in the clinics, yes, where are closed or isolated, to the outpatient level of care, as we see here, where the patient or client just comes to the office, yes, receives the treatment and returns to his home. So it's the shift that the mental health went through. And moving forward to the domain overview. So what I wanted to highlight here is at first is that from the doctor's standpoint, we have such a concept as disease. Yes, when you open any textbook in any medical specialty, you will find these areas for each disease. So epidemiology, etiology, pathogenesis, yes, clinical science, and so on. And from this like traditional standpoint, all of understanding what is disease, it must contain each of these and an understanding of each of this area. But in mental health, we actually know very little about the biological etiology of disorders. We have some pathogenesis concepts, yes, and pathogenesis is about the how is the cells changed, how the tissues are changed in due to some disorder. So we have some understanding based on the medication that we give, yes, but they are mostly concepts. Then we very little. There is very little use of lab diagnostic science in assessing most of disorders, and that brings us the treatment there. So the treatment is not etiological, and etiology is the reason. So we don't actually treat the reason, because we mostly impact this pathogenesis part here. And another thing I wanted to highlight is the paradox of normality. So we've covered the more medical point of view, and from the more overall point of view, the idea of normality is very fluent. So it's not the thing that it's for example, as the number of bones, yes, in human body, it will not change, or the way the woman gives birth to the child, it will not change. But in mental health, we have this bounded context. So what is normal and what is not normal is mostly tied to the time that we live in, to the era, yes. It's tied to the social environment where the person lives, yes, and there is also a cultural impact, yes, because based on this criteria, the shape of normality will change. Then moving forward to the approaches, yes, what kind of understanding of mental health do we have? So as was mentioned, we have the medical understanding, yes, as a part of medicine, yes, which is where the patient is 100 doctors' responsibility, yes, to treat, and the diagnosis and where the doctors give the diagnosis, yes, and it is based on the criteria, and there is an ICD, which is the International Classification of Diseases, which is known in the most countries. And in US, we have DSM-5, which is another classification of the mental health disorders. Then we have the psychotherapy. I thought about how to explain it very briefly. Yes, so it's actually psychotherapy is a kind of a lens. Yes, when a lens of understanding what is mental health and what does what do people feel and experience through the theory and practice of the psychotherapy school. And there are a lot of modalities, around 300, and in here more it is important that that the roles and that the responsibility of roles are changed. So here we have the responsibility is 50-50. So the 50% go to the client, yes, and it's his responsibility to improve himself or change, and the 50% goes to the psychotherapist himself. And then we have the neuro understanding, which is based mostly on the nervous system. It is more scientific, currently than practical, because at one hand it opens a lot of new layers that of understanding how our mental health functions, but still it does not bring any new, for example, biomarkers, yes, or new diagnostic approaches which we can use to diagnose and treat disorders more properly, yes. And moving forward to the subspecialties, yes. So I've identified four of them. So the first one is the child and adolescent, yes, which is actually, in my opinion, the most broad, because the mental health, for example, any states or disorders in kids from 0 to 3, and in adolescent from 15 to 18 will be very different. So it is a very big topic and a very big area. Then we have the adult, yes, mental health. We have the geriatric mental health, starting from the 60 years to and so on. And another area which I highlighted here is the addiction. Yes, the mental health of addictions. Yes, because it is a very big topic. It's expanding, and it's hard, and it is a big challenge in the mental health. So moving forward to the diagnostic approaches, I wanted here to highlight the differences, yes, how the patient or the client is approached and how it is different from the other specialties, yes. So we pay attention to the next thing, so as mental health providers. So the first thing is anamnesis, which is the history of life of patient, but it's not the biography. It's the history and the reaction of the patient or a client he went through and how he lived it, yes, and what he felt and what he can and what was his reactions, and also the story of his state or disorder, which is inside the story of life. It can be subjective, which is understood as it is gathered from the client or from the patient, or it can be objective when we gather it from his caregivers, yes, or relatives. Then we have the evaluation, where the provider tries to assess, yes, the mental health state, based looking and watching the behavior, watching the emotions, the reactions, the feelings. Then we have the psychological evaluation, which is mostly presented with different kinds of tests, projective methodics, kind of exercises, and it is for evaluating the overall mental health processes, as for example, thinking, feeling, mood. And it can also be disordered based, for example, specific tests for schizophrenia or for depression or for anxiety. And then we have a kind of a classic diagnostics, which we often see when we come to the doctor. Yes, so if he will suggest us some met results or scans or so on. But in mental health, in particular in psychiatry and related the related areas. This approach is mostly used to confirm if there is a brain disorder, yes, or exclude somatic diseases. So it's not aimed to actually identify the problem itself. There are some specific lab diagnostics, but they are not used in that they are not commonly used in daily practice. Continuing forward to the treatment approaches. So from the treatment standpoint, what do we have? We have the psychopharmacology, which is the part of overall pharmacology. So we have different groups, yes, of drugs that the patients can receive. Then we have the psychotherapy or consulting approach. Yes, so it can be like individual, group, long-term, short-term, in different methodics. Like there are like communication therapy when the therapist speaks. Yes, it's to the different behavioral approaches, as for example, like drama therapy, yeah, or from projective methodics, art therapy, yes, music therapy. And also we have other services which are mostly related to the type of disorder that we have, yes. So for example, a big impact is the social services, because if we have a patient with adverse, for example, psychotic disorder, he will not be able to treat himself, to interact with I don't know, to pay the bills, to schedule an appointment, yes, to I don't know, like apply to a job, yes, and so on. And these services are very in help for such kind of patients. Yeah, then we have, for example, for children, yes, we have speech language pathologists, yes, or we have tutors which accompany a child with some issues with like learning disabilities in schools. And another thing which I wanted to highlight here is the peer-to-peer support. It is a kind of it is a support which is based, which is provided mostly by the people who suffered from some mental health disorders in the past. They managed to they had a success in their treatment, and then based on their experience, yes, they provide and support another clients or patients. Purely peer-to-peer support. Or another example is, for example, when we have a child with an autism spectrum disorder. So oftentimes a mother of such patient will know of such child will know a lot more about autism disorders than any other psychologist or psychiatrist, because she actually sees his child every day. And yes. So moving forward to the key providers, yes. So we already mentioned a lot of things related to the providers. So here what I wanted to highlight that in mental health is from the provider standpoint, it is very important to give the multidisciplinary approach. So when the client or patient is approached from different standpoints, not only like through the medical lens or the psychological lens, yes. So we oftentimes need a team to approach the patient. For example, in clinic where I passed the internship and worked, we had, for example, a patient that came to us always had a psychiatrist. He always had a psychological evaluation, yes, with tests and so on. He always had individual therapy and group therapy as well. And this all, so it is a teamwork. And the providers that are not included here, but also can work in mental health are oftentimes the general practitioners, because they can approach the patient at first place, yes. And sometimes the providers can differ based on how the system is organized in different countries. And another thing here is that this slide does not mean that all the providers must be included. Yes, I mean all that I mentioned here and any other. It means that the providers must that the team must include the providers needed to the state and needed to the treatment that we want to give to the patient. So it's a treatment based. So it's sometimes also like a treatment based team. So, and what mental and where are the mental health disorders treated? So the most common way, which is now, it's then outpatient level. Yes, when the patient or client goes to the provider's office, yes, he receives the treatment, he receives therapy, yes, and goes home. Another way is the outreach, when the team, yes, or providers work on the client side or actually on the patient side, yes, when they go to their homes, they help them solve their like social issues, they give the treatments, yes, they check if everything's fine. And we have the inpatient level, which is inside inside clinics. It is base. It is mostly for the acute disorders or for disorders that, for example, when there is a suicide risk, it is always a criteria for the inpatient treatment. And this inpatient treatment, it can be as a ward in a general hospital, yes, where it's just a department, or it can be like as a separate clinic, which specialize only on the mental health disorders. And to conclude my part, so from the challenges, yes, what challenges do we have in mental health? So obvious, yes, from what we've spoken so far. So the first thing is the wrong and over diagnosing, yeah, because we are lacking of the precise criteria, we are lacking of the substrate, yes, to diagnose the disorder, and this often leads to the wrong diagnosing or under diagnosing or missing, yes, some disorders. Another challenge is the stigmatization, which is, of course, the attitudes to the mental health are far more better than they were, for example, like 500 years ago or 100 years ago. But still, there is this layer of sorrow, yes, for the patient to, well, sometimes to receive treatment, yeah, and there is this society attitude when these patients are or clients are treated as unnormal, yeah. And another layer which I added here also is the simplification. It's actually a new thing, a new challenge, but it is important to mention that due to a lot of information that we have to the yes, so via internet, on blogs and so on, sometimes patients or clients come to the provider and say, you know, I have a depression. I know that because I read it in the internet, yeah, and I have this like symptoms 1, 2, 3, and you must give me an antidepressant, yeah, or you must give me neuroleptic because I know that. And it is in 99% of cases, it is usually a simplification, yes, so it's the person tries to simplify his like feelings and states and to put them in some diagnostic criteria because it's the easiest way, but it's not that easy as it looks from the person's standpoint. Another challenge is availability, because the mental health system is oftentimes is on the tertiary level. So it means that the patient must go through the general practitioner first, then to exclude all the disorders, and only then go to the providers. So it's sometimes long, or a lot of providers are private, so it's not always affordable, yes, and not always the person can receive this team approach, yes, in assessing his states. And another challenge, which is, well, it's not like super specific for the mental health domain, no, but it is a challenge that it will shape the mental health as well, because as you remember, we've mentioned this bounding context, yes, of normality. And of course, the bunny world that we are that we are living in, yes, so we have COVID-19, we have war, we have recession. Of course, this will have a very big impact, and already has, yes, on the mental state and on the disorders that the patients will have. So This is my part, and I will thank you, and I will pass word to Yulia.
Thank you,
Yulia.
Oleg. Thanks a lot. I'm here. And now let's try to move all this process you've subscribed to a digital domain. How can we digitalize it? How it is digitalized already? And how it works now? Could you please? Yes, thank you. So we have mental health domain stakeholders of the situation Oleg currently subscribed. First of all, the first group are people, which are personal users and independent service providers. Personal users are clients who are trying to deal with the problems, as Oleg mentioned, like a stigmatization of the psychology. Sometimes we feel shy. Sometimes to say that I need some help in mental domain means to say there is something wrong with me, and nobody wants to be wrong. And we need some more information. How does it going on in the psychotherapist cabinet? How can I find help, and do I really need help or not? And sometimes you just want to talk to someone. So in this case, it's easier to do anonymously, and in internet you can find the help and information at any moment which is comfortable for you. So another way are independent service providers like us, private practitioners, psychotherapists, coach, consultants, who also are looking for for the community, for the clients, for new colleagues. Institutions like as government, researchers, and universities who needs the proper data of the current situation, and also who spend a lot of time for the medical care and support to the citizens, to the vulnerable group of the citizens, and also how to solve problems with ADHD children and their education, for example, homeless people and their repeating crimes with adults who lose their effectiveness at work in meaningful numbers. So it includes also the changes of medical care services, of insurance planning, and so on. As for businesses, there is an issue for employers. For example, in 2020, according to the Deloitte's reports, in Great Britain, employers lost around 56 billion pounds because of the lack of effectiveness of their employees caused with mental conditions, issues, and disorders. At the year before, the number was 42 billion pounds. So you can understand the rise and the size of the problem. Also, in sales and marketing, there had been a big dream for a long time to understand how do people really use the things. What is their real response of using this stuff, of using the services and things they bought. Why do they do that? Uh, you know that many times when you share your review or feedback about the service or the product, you just wanna be looked in some way. You wanna play some role. You wanna be accepted as the expert, as a cool person, as the fancy thing, but not what you really had experienced after consuming the kind of content, using some service, uh, buying some stuff. So there are some additional points and conditions how to understand better how do people use the stuff, their user experience, their client experience, and how it could be improved. Producers and service providers, of course, there is first of all pharmacy and medicine who offers their was traditional pharma and psychedelic assisted therapy, which becomes a new fashion these years as used in a small dozens. And again, it's connected to the I mentioned before Bunny VUCA world when we face more and more challenges every time. We should be more and more effective. At the same time, we still need some additional time again and conditions to be good partners, to stay in our family and relationships, to be in a good mental and physical fit, to be again an effective persons, and as well to have our life quality. So there are still millions of people who try to find a magic pill to feel better. Also, there are care and well-being service providers. So part of them, Oleg mentioned, and also there are big companies and big players of healthcare industry who understand the quickly rising new domain of mental health. Because of, for example, in 2019, around 11% of US adults reported their experiencing of anxiety and depression. At the same time, almost at the same time, in December 2020, that number skyrocketed to 42% of adults who struggling with anxiety, depression, other mental disorders and conditions. So some of experts even called that a new epidemic, a mental health disorder epidemic. Another expert says that it's just a seasonal new fashion in digital. So let's try to see the whole picture. Could you please the next slide? Thanks a lot. First of all, some treats and in global mental health market was valuated in 383 billions in 2020, and it is estimated to reach up to 537, around up to another sources, it's 560 billions by 2030. Growing at a CAGR of 3.5%, other experts say 4 and 6% from 2021 to 2030. Of course, these prognoses were made in 2020 and 2021, not now when all the situation had changed extremely, but at the same time, we have the same new challenge. We are all experiencing trauma of witnessing, of watching the war online almost 24/7, which has also against with the recession creates a new issue and at the same time not a new possibility, but a new extending of the domain. As of 27 October 22, there are 97 health tech unicorns around the world. There are different unicorns in hardware domain, in preventing and care and treatment, facing and solving different issues. As for mental health domain, there are still 10 unicorns. We will talk about them a bit later. And the very first one was Calm, which became the first mental health unicorn in 2019. Probably you know that app. It's an app for meditation and which helps people to increase their mindfulness, to feel better, to feel happier using meditation practices. Good, yeah, thank you. And here it is the analysis by CB Insights agency, where they started to show the deals and fundings in mental health domain since 2018. The very first deals were made in 2016. There were 65 deals in total. Here you can find that the 2021 was the biggest peak of deals and of rise of projects and also in unicorns in 2021. The domain was growing up increasingly, and in 2022, according to the force majeure situation, the deals calmed down in the first half of the year, and now they are rising a bit. Could you please? Thanks. As for worldwide deals and fundings in the third quarter of 2022, the USA still is the biggest market as it has been from the beginning, and also it still could be explained about cultural differences, as Oleg mentioned a bit before. Like in USA, the mental health treatment and support is more popular and seems to be a more common thing than, for example, in Asia or Latin America. As well, Canada and Europe doesn't seem to be such a big market. Still, there are some cultural differences, and as well, there are some difficult, some specifics of mentalities. But still, so far, USA is the biggest uh, money source and biggest market of mental health domain. Then we have Asia, Europe, Australia, Canada, and Latin America. Also, sometimes there could be some different other explainings. For example, probably you know the AI chatbot replica, which became rather popular and which was ground in US. It's a chatbot based on machine learning and AI, which is starting from your way of communicating to the chatbot. Probably it's the best one, the most smart and sophisticated chatbot which can joke to you, send you memes and music to rise your mood and to support you. It can chat rather ecologically when you are in some vulnerable situations or some mood, but it was unexpectedly extremely popular in Latin American Catholic countries in LGBT community, which was also interesting to see, like the example when the topics of LGBT some in many straight Catholics cultures could be a bit non-usual to discuss with your friends or your close cycle, but it's good to discuss anonymously if you need it. Could you please? Yeah, thanks a lot. So there are main mental health domain solutions. Of course, when I put these 4 columns, I don't mean that they are clear and strongly bordered from one another. The all of them are the mixed technologies. When we talk about diagnostics and measuring, we use mindful trackers, sleep trackers, fitness trackers, which are usually the hardware supported with mobile and web applications where you can see the analysis of the data they gathered from you. You can have some tips, recommendations, support. If needed, you can contact to the real specialists, or if it's good enough for you, still continue using the machine created tips and analyses. As for telehealth, is the most beloved by investors actually. Part of the domain solutions, there are mainly P2P and mixed matching platforms where you or a company or a private person can find the specialists or company solutions or subscriptions to deliver your pills to you at home every month or so on. And as well, there could be hand-on app solutions which are very new and give you some tools to feel better in at home and to have your digital specialist at home, and those solutions would be created specially custom tailored solutions for you. Data analysis and machine learning, emotional, which mainly tracks your emotional response tracking, your content consuming tracking, your custom tailored solution, and builds custom tailored solutions for you. And we talked a bit about marketing and sales issues and business issues for the uh, um, for the client and user experience in digital world. It means like we can there are neuromarketing agencies who use invasive tools to understand and to gather data for the metrics of your emotional response tracking. For example, Ukrainian startup 110, which collect the user experience of watching movies and advertisement, and give the tips for uh, movie producers and advertisement agencies what kind of the content would be better for what kind of and what type of the auditory. The same as for content consuming trackings and custom tailored solutions in this way could be personal recommendations to aimed for the person based on the real emotional experience of using that or this kind of content or stuff. As well, AI also, for example, another example of that was the neuroscience research made in 2018 when neuropsychologists using machine learning analyzed tweets of around 4,000 Twitter users who had consented, of course, to be the part of the study, and using the algorithms and extracting such features like colors, facial expressions, pictures that people were posting, the words they were picking up to explain their feelings, emotions, and so on. They created the algorithm that could predict the possible depression 3 months before it happened. So just analyzing the open source data people use to share with others on Twitter, it could be possible to predict a person that these tips could help you to avoid depression, to feel better. If you don't do that, according to the current situation, you can get depression in a couple of months. And there are main categories of mental health in most valuable startups as for Startup Talkie website.com in 2022. There were solutions for peer-to-peer, digital therapeutics, and digital diagnostics using measurement and testing, using tools for sourcing, and mental wellness applications. Also, there is another interesting topic to understand how we can separate mental health domain, which is the part of healthcare domain, and the well-being and wellness domains, which helps us to be more proactive, more effective, live better life, be more satisfied with how do we live our everyday routines, how we work, how we feel. And of course, there are telehealth medicine, which is most common and most understanding. Like it just brings your specialist where you are and where you can feel comfortable to have that treatment and support. And the next slide, please. Here we are. We have the best mental startups, mental health unicorns, according to the third quarter of 2022. This is probably the most famous one for now, the Cerebral, founded in 2020 in USA. It works in prevention domain, and their solution is to help people with depression, bipolar disorder, with anxiety, and other disorders that could be supported with medicine. So they offer different kind of subscriptions where you can find the specialists, you can get your diagnostics, and you can make a subscription for the medical care treatment delivery to your home. Better Up is another solution which helps companies to support their employees with mental health care, and to they offer either psychotherapists and um, coach practices and some consultings to help people to feel better, to be more satisfied during their working process. Lear Health is more classic platform where you can find the best therapist for you. You can find the best match and health care and support of psychotherapists, consultants, and doctors. Calm, as we mentioned it today, the app, meditation app, which helps people to feel better using their very easy to use tools, using some music for meditation, understanding better what meditation is, and of course, if needed, you can find your meditation teacher. Cry, which is the only non-USA unicorn for now. They are Sweden based, founded in 2015, and they offer medical health treatment in the list of other medical care solutions. They became unicorn when after they started to build the mental health unique community to help people to feel their better life, better life quality, to have a more happier and satisfied experience of everyday routines, not to push people for them to be better version of yourself, but to have better satisfaction, better feeling that you live your own life. The Spring Health also work for the companies as well as modern health. LMI and Maven Clinic offers their services for families and for children with some special mental conditions like ADHD disorder um, and autism and other disorders. Maven Clinic supports families, and LME is more focused on children. And the next slide, please. Or I guess I have to give a word to Oleg to finish our part of sharing our information.
Yeah, so we just wanted to conclude here. Yes, so the overall presentation is done. So it's just to highlight. Yes, so as the mental health is the part as an integral and crucial part of the human well-being. So the solving, yes, of this mental health challenges is the huge opportunity. Yes, and as Yulia mentioned, it is a growing market. Yes, and the improvements will leave and the solutions that we will bring, yes, that we will conduct, they will have a very huge improvement on the personal lives and the communities, businesses. So it has some very expensive, yes, benefits in solving problems is in this area. So it is all from our side, and we would like to move to the Q&A. Maybe there are questions or suggestions or any other things that you would like to ask us about. So please feel free to unmute and ask the questions, colleagues.
Or you're also welcome to text it in the chat if it's more convenient to you.
Thank you, guys. Thank you a lot for such amazing presentation. And while our colleagues thinking about their questions, I want to ask things that disturb me and about artificial intelligence-based chatbot. And it's really funny that
Yes.
you can, yes, if you can ask some, let's say, prohibited topic that you can't discuss with other people by some reason, whatever. But in a real crucial case, and if, for example, person have some suicidal thoughts or something like this, and he really needs support and he will use it, is it, do we have such technology that can help
Yes.
in such situation? How? Please elaborate a
Um,
little bit about that.
yes, thanks a lot. And to prevent suicidal situations was one of the main goals of creating those chatbots, because of sometimes not every human can give such right support 24/7. But for the chatbot, it's more easy. And of course, it can prevent, it can help, it can give ecological support, like being very careful, continuing the dialogue in place of in place of just reporting to some services. But from another hand, if to step aside from the suicidal topic, there are still some difficulties and some dangers of the safety of using using AI chatbots, because they are still um, teached chatbots, and who people still are correcting their answers. It's supervised machine learning, and sometimes there could be some tricky situations, as probably everybody in Ukraine, many people know about Replica's case, when they answered that the Bucha massacre was fake, and after users started to share the screenshots, so the team changed the answers and corrected the work of a chatbot. But yes, still the AI is our mirror. So it depends. There are still some questions that are worth to be researched better, and maybe the topic for the next webinars if our community will be interested.
Yeah, I would like to add from my side, it is actually the one of the next webinars that we will show the list, like after the Q&A. It is the challenges, yes. So we like at first we bring some solutions, but on the other hand, we can cause some additional layers of disorders. And from the suicide standpoint, well, in my opinion, like based on the experience, it is these solutions are probably, we need to distinguish, yes, the level of risk of the suicide, because if it is about the prevention, then it might probably be a very good solution when the case is that they did not went too far. Yes, for example, if there are, for example, thoughts but not the real intentions. Yes, not planning the suicide, because this suicidal behavior has its own like steps. It has its own flow on how the person goes through the suicide, and it's mostly not because they want to die, but because they cannot live. Yes, so the reasons of suicide is this. But from the question that Vitaly raised, yes, I think that it's just we just need to add an additional layer on how hard the risk is, because if the risk is hard, of course, we need to put the patient in the inpatient settings, because there is a risk that he will do the suicide and monitor the state. But if we go from the prevention standpoint, then it is a big opportunity, and it can help, and the patients can benefit from such solutions. Colleagues, we have 2 minutes left. We would like to wrap up, just not to hold you on the call. And the last slide we would like to show to you. We would like to give a series of webinars, not only this one, yes, but like a big series of what we can tell you, yes. And we've come up with some ideas. I suppose we can share them through the email as well when we will share the presentation. So, and this is the ideas that we came up with for the next webinars. So you can vote, you can send your answers and suggest what is the topic that you would like to know. I'll put this in the chat also for you. And if there is any idea which is your part of interest, or based on the case or the experience that you had in the mental health domain as a professional, so please tell us, and we will try to cover your requests and provide the next webinars based on your preferences.
As well as you have any experience or ideas to share with us, please welcome to join us, and you can be a speaker, or your topic would be chosen for the next webinars.
Yes, and also from the mental health stream, so we are part of the mental health, like a mental health substream. Yes, so if you are interested in the mental health and would like to contribute or to attend, so please, yes, feel free to ping us, and yes, we will collaborate as well. So I suppose that is all, and we can close our webinar for today. Thank you everyone for attending. I hope it was useful, and see you on our next meetings. Bye.
Thanks a lot, guys.
Thanks.
Thank you, Yulia. Thank you,
Thanks,
Oleh.
bye.
Thank
Vitalik.
you. Bye.
Thank
Much
you. Bye.
appreciated.
Bye.